Thank you. This is a topic that no one really likes to hear about, but TAS is very important because it can happen sporadically or it can happen in focal outbreaks. And so I think it's critical to understand what can cause TAS and how we can go about preventing it. And so I really have no significant relevant interest in this particular topic. First of all, what is TAS? TAS is an acute postoperative inflammation, and it's critical to realize that it's sterile. We're not talking about infectious endophthalmitis, but we're talking about sterile post-op inflammation. And what sets TAS apart is TAS occurs immediately after surgery. Usually cases of TAS occur anywhere from 12 to 48 hours after surgery. Now, one of the most common clinical findings we see is diffuse, what's called limbus to limbus corneal edema. And you'll see widespread signs of endothelial damage. This is not the edema near the wound or the edema that can come from the phaco-tip. This is a widespread limbus to limbus edema. There's also significant anterior segment inflammation. You can see increased cell, increased flare, hypopyon formation, and even fibrin that you can see on the surface of the iris and fibrin in the anterior chamber. So very much a hallmark of TAS. Lastly, you can see potential damage to the iris and also damage to the trabecular meshwork. And so you can have fixed dilated pupils that aren't going to constrict well to light. You can have problems with glaucoma secondarily. And so this is a significant widespread damage of the entire anterior chamber of the eye. Now, what can cause TAS? Anything that gets into the eye during cataract surgery or after cataract surgery is potentially a source of inflammation. When you look at irrigating solutions such as BSS, there can be abnormalities of pH, there can be abnormalities of osmolarity, there can even be particulate problems within the BSS. One of the first outbreaks of TAS that we looked at that was widespread was there was an outbreak in the United States on the East Coast in 2005 where there was widespread cases of TAS that was occurring. And when we looked into this with the help of the United States CDC, what we found was that almost 90% of these people were exposed to a particular brand of BSS. And when we analyzed the BSS, what we found was that there was an increased incidence of endotoxin. There was a problem during the manufacturing of the BSS which led to contamination with endotoxin, and when this particular product was withdrawn from the market, it led to the stopping of this outbreak of TAS. Now, this outbreak of TAS was important because it was one of the first factors that led to the ASCRS TAS task force, which is put together. And since that time, I've had the pleasure of co-chairing this task force, and we've been looking at various causes of TAS now for several years since then. This task force is important because it's got members of both the CDC from the United States, it's got the United States FDA. We even have members of industry that give their input to this task force. Now, when we look at any ophthalmic solutions, it's important that they be preservative-free. One of the common preservatives used in ophthalmology is benzalkonium chloride. But we also want to remember that there can even be stabilizing agents such as bisulfites and metabisulfites, which are used to stabilize the epinephrine that we use in our solutions. And so in the United States and even in most of the world now, there's a great shortage of preservative-free epinephrine. And in fact, we've now had to use epinephrine that actually has these stabilizing agents, these bisulfites and metabisulfites. So it's critical if you're using epinephrine to help dilate your pupil or in your solution, this needs to be diluted at least a factor of 4 to 1 with either BSS or lidocaine or other solutions in order to be safely used inside the eye. EDTA, fortunately, is not used very common in ophthalmic solutions. Now, antibiotics were being used more and more now, with intracameral antibiotics being used from the ESCRS endophthalmitis study and antibiotics within the irrigating solution. And it's critically important that these be mixed up properly. And right now, because there are no commercially